right. Well, good morning, everybody. How's everyone doing today? This is Kerry Mahoney from the ARC of Massachusetts. Welcome to our Problem Solving Support and Resources Tuesday webinar. And I'm excited that we have a special guest with us today. We have, I'll do the next slide. If I can.
Oh.
There we go.
There I am.
There's Kathy. So we have Kathy today. Kathy has an extensive background in actually supporting people and adults with intellectual and developmental disabilities. She was out in the western part of the region and worked for DDS for how many years?
Almost 39 years. Yeah, 39.
Oh, wow.
Years.
Okay.
Yeah. I started at Belchertown
Yeah.
and then went out in the community.
And so you've seen a wide range. So, Kathy, maybe you could tell people a little bit more about yourself and what all these fancy
the Mickey Mouse, all the initials. Well, I'm a nurse. I'm an RN. I'm a nurse practitioner, and I'm a family nurse practitioner, and my master's degree is in gerontological nursing. So I'm really interested in aging issues, and I've become, I'm doing a lot more work. I'm on the National Task Group on Intellectual Disabilities and Dementia. So I do a lot of work for them around dementia and best practices. And I've been working now, I've been on a couple grants through DDS, and I'm going to be working with Dr. Julie Moran and working to support people. But, you know, I've done a lot of stuff over the years, and I think I'm most appreciative because I always tell family members and people with intellectual disabilities and staff that you are my best teachers. So I'm forever grateful, and I try to be pretty practical and consider, you know, it's always, I try to also maybe trying to bridge either academics and research with real practice and giving people what they really need. So, and I was also one of the first nurses, actually, my number's 5 as a certified developmental disabilities nurse too. So one of the things, I'll just get started, is that that we know, and it's been interesting, is that first of all, and across the Centers for Disease Control, the CDC's website, they have a banner that's COVID-19 is an emerging, rapidly evolving situation. And if that's one thing you take from this, is that, you know, what we know now may not always be quite the same tomorrow or the next week. So I think be aware, you know, we do the best we can with what we know at the time. I think about that all the time. And that's what families need to do too, or must do, and we all do. So to be aware of this stuff is that things do change. Like in Massachusetts, you know, now we're wearing masks, but we, you know, early on in the pandemic, we weren't required to wear masks outside. So just take that and with you. And the other thing I just want to move, I have a lot of information on these slides. They're there for resources like a handout. So bear with me, and I'm going to not read everything on the slides. Next slide, please. So the thing about it is that when I talk about healthy living tips, the first thing is about infection. Infection matter. And I think that the things about infections is to remember about the whole point of infection control is prevention, because we don't have a lot of treatments. Is that the main thing that we're doing is prevention. So all of these interventions you see on the left have to do with keeping you safe, keeping people safe. And the issue I find comes up is being able to make these things happen, and in a way where it becomes part of your daily life and it's not too onerous or overwhelming to do. So a couple of things, and I'm not going to go into all of these things about infection control because you've had a lot of it. The only thing that you know, knowing how and when and what to do. You know, for instance, people that I know are just using straight bleach on cleaning things, and that's overkill. So finding out what do you need to do, and make sure, and I have a list of resource sites and one of my other slides to go. But the thing I wanted to kind of bring up about this is just about the virus itself, knowing some things. So we know that it takes anywhere between 2 to 14 days. You can catch the virus, and it can take anywhere between 2 to 14 days before you show symptoms. And in between that time, those 2 to 14 days, you can actually give it to somebody else. So you're contagious. Even before you see, and the main symptoms are fever, cough, and shortness of breath, although the WHO, the World Health Organization, came out with some newer symptomatology, such as chills, muscle pain, headaches, sore throat, and new loss of senses of smell and taste. So I think being aware of those kinds of things in terms of keeping yourself healthy. The other thing is, I can't help but tell you that your own immune system is a key, an effective weapon against COVID-19. So all of those things that nurses and myself keep, nagging people about, eating nutritionally foods, eating right, doing movement, physical activity, sleeping, stress management, keeping your vaccines, regular vaccines up to date, are key to keep yourself well, because a lot of people may have come into contact with the virus, but their own immune systems have enabled them to actually fight it off. So I think those are some key things to remember. And the other point, and it's my next slide, is what do we know about testing? Next slide, please. So I appreciated this slide from the New England Journal of Medicine that shows what it's like. And I wanted just to clarify for you is about testing itself, is that there are really two tests. The first test is for the antigen or the virus itself. In this slide, the nasopharyngeal swab shows you about what the healthcare providers need to do in order to get a specimen. And it's not the easiest thing. I don't know if any of you people who are attending ever had that done, but it's not easy to do. And I attended a webinar that a pediatric, Dr. Spinozzi, I think, Spinozzi, who's a pediatrician, has a Down syndrome pediatrics clinic, talked about, some ways that she found it easier to kind of help people through the process. So I think, and there's a lot of issues with that test itself. Many people have talked to me about, well, I've had the symptoms, I'm testing negative. And there's a lot of false negatives out there, and it's because either the poor quality of the specimen itself, it's not handled properly, it's collected either too early or very late in the course of the disease, and it might be just technical reasons. So I think even though you may have a false negative results for your COVID virus antigen, and the antigen is the germ, doesn't mean that you're not necessarily have the disease itself. So that's one issue. The second thing is the antibody test. And that's the second one, and it's a blood test. And what this test does, antibodies, your body produces a protein to protect you. And these proteins are immunoglobulins. And what we know, they can be anywhere from 7 beyond days, and it depends on your own immune system, how quickly you're going to be building up there. One of them is the IgM, which shows up first, and then there's another one called an IgG, shows up later on. And this is what, when we talk about, well, being protected and being able to go out there and be safe, this is what people are looking at. But the problem is that we don't know how long this is going to last, whether or not, even if you show them, because if you've got another kind of coronavirus, you could have IgMs and IgAs show up. So is this really against the COVID virus? We don't know. And that's the difficult thing about this disease. So I think keeping yourself healthy, this is an important thing to remember, getting the right knowledge and understanding these things. Next specimen, next slide, please. Oh, next slide. Oh, thanks, Kerry. So the next thing is caring for yourselves. And I think that this is essential. And when I talk about healthy living tips, is remembering the airplane oxygen and mask directions. And this is one thing because I do a lot of training around dementia care, dementia capable care, is remember to it's what they tell you in the airplane, put your own mask on before putting on the mask on somebody else. And the reason is you're not going to be any good for anybody else unless you take care of yourself. So when we talk about taking care of yourselves, okay. One of the things is looking at what is healthy living. What are some things? Eating well, trying to eat, foods, everything. I'm not going to be a broken record telling you about, eating green leafy foods, making sure to have some protein, avoiding saturated fats in your diet, making sure you drink a lot of fluids throughout all of this. This is all really important. So eating, and you can get a lot of information on what are our proper diets and how you should eat. The Mediterranean diet, etc., is one that has a lot of, it's been verified as being something that's important and something that works for people. Physical activity. Now that's one thing that I think that we need to kind of move. And I hate to use the term exercise because it seems like, oh my God, I have to exercise. But it's like even just moving around, getting out, walking around. And these times, walking about, if you have a neighborhood that you can get about in, is important. One of the things that Brian Chicoine, whom he's the go-to guy around Down syndrome, I believe. He's a physician who runs an adult clinic in Chicago. And he talked about all of these things: eating well, physical activity, sleep, stress management, getting out, a dose of outdoors, getting outside. The other thing is that the outdoors, even though, we've heard a lot of controversy about this whole ultraviolet or sunlight, but sunlight is an important source of vitamin D, and vitamin D also helps your body to fight off infections. So to remember getting outside, and there's something about how it raises our hearts and our souls just to get outside in the sun. And we're finally having some sun in this part of Massachusetts. So it's really important to have a dose of outside and getting some sunlight and feeling the air against you. If you can, I think also remember some of the distancing. And I hate to use the term social distancing because it really is physical distancing, because we all need our socializations more than ever. So develop routines. Routines are key. In this day and age when there's so much uncertainty, and I think that uncertainty is so unnerving to all of us, and a lot of us are control freaks, and so this is especially difficult. So having routines are important. Or, you may not be able to have all your old routines, but looking at new kinds of routines that you can implement. Last night on a webinar I was doing, people had questions about her son with Down syndrome. He wants to go to the store. So is it safe for him to get into the store? Even if we go at the times, in the early morning when older people and people with immune system disorders can go there. And, one of the things we talked about is developing new routines and have him be a part of figuring out, well, it may not be the right time, but how about driving with me, in the pickup or helping me figure out what we should order online. And so I think looking at developing new routines and working together on this, again, planning also gives you a sense of control. So looking at some of the things, what can you plan for? How can you, and be aware of there are some things are just completely out of your control. And being okay with that. I think that that's the hard thing with a lot of us, that is we hold ourselves to high standards. And for a lot of us, we have to, because we wouldn't be where we are and we wouldn't be able to support our families. So to be aware of these kinds of things, some things are in control and some things are not in control. So, and this was the little mental well-being, all of these routine outdoor sleep, making sure you get enough sleep, trying to figure out. The other thing is news, getting a balance with news. We get so inundated. I have talk, a lot of the public radio station have news programs, so I listen to, and it just can be so unnerving lots of times to be hearing things. And just because we want to know, we want to figure out what's going on and want to be knowledgeable to give us some sense of control, but it can be so overwhelming at times. So give yourself a break and get a balance with listening to the news, especially news about COVID-19. And also trying some positivity. Try to be positive and pausing in gratitude, writing little things. What am I grateful for today? It's like we've been having rainy weather and it's been a little chilly, and I came across, I somehow, I don't know, it came to my mind is that lately in our, at least where I live in Western Mass, but lately it seems we've had such short springs, and the springs, it seems like 1 minute you've got like the bulbs are out and the next minute it's 80 and 90 degree heat. We have no spring. And with this cold or colder, cooler weather and some of the rain, I think we're having a lingering spring. And it's just, my flowering quince are staying flowering for a longer period of time, and the bulbs are not just quickly going away, the flowers on the bulb. So I think I'm grateful and realizing those kinds of things, gratitude for that. So the other thing is that with any of this stuff is to really, really make sure, these are the things that I'm talking to you about is the same for all members of your family. If you have a family member with a disability, it's the same thing, the healthy live sweet. And then the other thing is like, and you'll see in my next, I have a little, I'm appreciate laughing and having some not real jokes. I'm not great at telling jokes, but, looking at cartoons and getting silly about things, there was never underestimate what the power of nonsense gives to hardworking people. There was a sign on an office door one time, and I'm a true believer in nonsense. To me, it's one of our better senses. So I think to look at some of these kinds of things in terms of how we can take care of ourselves. Last week there was a great AUCD webinar on taking care of yourselves, and I don't know, I can make sure, I think you probably got it. I think Bill Gaventa talked about it yesterday, but it was excellent. They went to a lot of details about this. So, and they had a lot of things. I think you have to find something that fits into your lifestyle and that you're willing to do. Even for a lot of people, praying, if you have things, and using technology, taking advantage of technology, like getting together as a group of us get together on Zoom like once a week, and we just have a little get together. I mean, I know people are having cocktail parties on Zoom. So I think things like that, trying to make it so that, having a birthday party on Zoom, or making sure, the person that you live with with disabilities can get out and see people. I know I have a friend with an intellectual disability, and they want to set up his ISP, and they're going to do it on the phone. And I'm like, I hate phone meetings. For one thing, there's all this background information, and you can't, I said, can you get a Zoom meeting or WebEx? I think DDS has WebEx now, but get a meeting where people can see each other. I think it's really key, and you can figure out what's going on. And also, I think for a lot of people with intellectual disabilities, they're very visual. And I think to have that vision is also a sense of reassurance to all of us. And also, above all, be kind to others, and be kind to yourself. Next slide, please. So information integrity. I think that's the one thing, is that getting the right facts. And here's the bit of nonsense. And I have to tell you, I get this, I get so many emails, on, especially around medical things. And there was something from, I forgot what group, Medscape or something. And there was this with Dr. Oz, and somebody said, put a mask on, a duct tape mask on Dr. Oz. And I'm like, what? Is that really true? And it turns out it was just a joke somebody was doing. But, for me, it was like, seeing that, it's like, oh my gosh, but it was silliness. And so I think looking at who do you get your information from, and getting from reliable resources. That one thing early on in this in this pandemic, I mean, I would get emails from my friends and they would say, oh, you got to do this, da, 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 da. And I'm like, where are they getting this information? I mean, people mean well. They want to help everybody out and do well by their friends and their family. But I think you have to kind of be discriminatory on where you get your real information. So the CDC, it has the best information. It's very readable. They have a lot of things on it for everybody, you know, including how many teaspoons of bleach to put in water, you know, to make a cleaning solution, things like that. So I think going online, the WHO has some wonderful information. That's the World Health Organization. And then you have other organizations that are like professional, the National Down Syndrome Society, IACID, which is the International Association for the Scientific Study of Intellectual Disabilities. They have, I'm a member, and I went on, and they have a whole list of resources for people with intellectual disabilities, including a lot of information in Spanish, etc., talking mats. I mean, I think I don't know. I hope I have that in the back for one of your the slides here. But there's a lot of information. You know, Brian Chicoine, the Advocates Group. And there's a great group out of Britain, UK, the Social Care Institute for Excellence. And they have a ton of information there for families, for people with ID, and for staff. So, you know, because a lot of us, you know, will be supporting, you know, direct care staff who are the people that are working and supporting your family members. So we have to work in a team partnership together. Of course, we have our state guidelines in general, Department of Public, you know, the public health guidelines, and then DDS. DDS has a lot of information out there, you know, and things do change again. So everyone, you know, every couple of days, you know, to get online and to look. And I think the ARC is doing a great job with Leo, with his weekly, you know, call-ins and meetings. Kerry's doing a great job. And so finding sources that you can trust and have meaning to you. The other thing is that our own town and cities have public health departments, and they're great resources. They also, you know, when you're thinking about what should I do, like taking somebody to a store or not, you know, hopefully, you know, you can call up your public health nurse. Ours in Northampton is incredible. So finding out what they think about certain things is really helpful. And then for some of your older families is our area agencies on aging or elder service agencies have a lot of information. They have intake and referral sources. So if you need to have something, you know, they're the group of people that do Meals on Wheels and other kinds. The other thing is that if you have somebody who's in a nursing home, they're the people who are the ombudsman for nursing homes, even though they can't go into nursing homes. But I would contact them if there's any concerns about things. And then for also the resources for your family members. And the thing about it is that also of interest, I know that the Massachusetts, I'm on our hospital ethics committee, and the issues around the scarce resource allocation. And the reality is that people should realize this only comes into play if there are no ventilators, if there are no resources. So not to worry about it. Most in Massachusetts, I think we're doing pretty well. So to be aware of that. And there's been a lot of, I've seen the new guidelines is that there are a lot more talking about, you know, people with intellectual disabilities and other marginalized people in terms of how to decide with the allocation of scarce resources. The other thing is that DPH, to be aware of it, and these new guidelines has a lot more oversight in what's going on. But to get back to some of the information integrity is navigating. Honest to goodness, I don't know. I get so many webinars and there's a lot of things for free, you know, and it's like, where do I go? How do I deal with this? I think having people you trust, going to some people like the ARC saying, what do you think about this? And, you know, some things are, you know, some things, we all have our individual tastes and preferences. So I think taking things and trying to figure out what's a good resource, but I've given you some that I know that are time tested. Next slide, please. So for people, for our family members, I have some And I think you probably already know about a lot of these. The Green Mountain Self Advocates have a lot of plain language resources for free. The IACID, here's the site with the link. So go on there. You can go get information from there. There's a resource tool from the DD, the DD services in Wisconsin. And then I know that Bill Gaventi talked about this, and these are available for free downloads on the COVID, and these are books beyond words. So there's 4 books actually. So these would be, can be really helpful, and you can get them online for free. So I think, we have to support our family members, and, if you have, I don't know how much direct care know about this, letting them know about some of this information, and some of the supervisors or your service coordinators. Next slide, please. And so don't reinvent the wheel, and I mean, a lot of this stuff, when I talk about healthy living tips, part of this is in terms of giving you some reassurance and giving some things in power. So, we talk about how do we, with the people that we, our family members, how do we make sure the information is going to, if they go into the hospital or whatever. And Stony Brook University has disability COVID-19 forms that you can go click online for free, and the refillable forms. So that's one option for you. And then My Health Passport is another one that is available for you to use in terms of making sure the information and for your peace of mind. When I talk about healthy living tips, having some of this information for your own peace of mind. That's what for healthy, that's why I'm including this. Next slide, please. So I think planning ahead, an ounce of prevention worth a pound of cure. This is actually, I had the wrong aphorism here, but advanced directives are another way to give you some control. So for your peace of mind, thinking about, the future for your person and for yourselves, I think that's a lot of things. So one of the things I think DDS has its own webinars about planning for the future, aging things, and I'm not going to go, the link is right there. In fact, you'll see me and my friend Bruce, we did the section on 5 wishes. So but it's for those of us, our family members, I know that I'm sure the ARC and other places have developing your own emergency preparedness plan. If something happens to you, what should you do? So this is just, a lot of this is, again, mostly as a handout for you to take with you after this. Next slide, please. So proactive planning, in terms of thinking about things, if something happens, God forbid, but if something happens, and looking at this for yourself, what's important if you're having a good day. I think we have a lot of sense about things, but this might be a nice little activity to do, or, maybe in terms of, and sharing with people about what personal would you have to impact care. Maybe some people, there's, have to say, have to have the ability to say their prayers at night. So I think there are a lot of things that we do that are very personal, important to us. So having this, having these kinds of things for for the person that we support too. And again, how this is healthy living tips, it's giving you a better sense. It's putting your mind at ease when I talk about stress management. Next, please. And then lastly, if somebody goes into the hospital, what kinds of questions should you be asking? And then the National Institute for Care and Health Resource, this is actually from the United Kingdom too. I was going to school in England for a while, and so I have a lot of colleagues and friends in the UK. So these are good questions to ask about, if somebody goes into the hospital, how can you help the person in the short and long term? And there are a lot of things that I think in terms of with this disease we don't know about, but we're finding a lot of things out. For instance, it does affect our blood clotting. So there are a lot of people that may have both micro blood clots and macro blood clots, and they've been seeing a lot of issues with strokes for people with this disease. So, and a lot of things pardon?
You came in by yourself.
Say again?
I remember now, yes.
Okay. So there are a lot of things
yes,
that
yes.
Oops, are you talking to me? I'm having a hard time hearing.
Yes.
Hello?
Well, I've been short of breath.
Oh, so you've been short of,
I've been
okay.
taking the,
Okay, so are you saying that you're short of, are you just automatically, are you all the time short of breath? One of the things that I would suggest, and maybe we could even talk after this, is that you should really call up your healthcare provider and let that person know these things. And that person knows you well, and they can direct you to get the more appropriate and the better care. But shortness of breath is a sign of, can be a sign of COVID-19. So, but it has to, there's a lot of things that go into it. The other thing, lots of times older people, I just saw something from Kaiser Health News, is that older people may not have a fever. So I think the key point about symptomatology, my sense is that we know, sometimes the people we support don't always show the symptoms, but a change from how they usually are is a key finding. So if this is different for you, if this is a new finding, that's important to report to somebody. So I think that these are the kinds of things that, to ask about that for your family member, for yourself in terms of treatments. Next slide, please. So, I mean, the last of it, what really matters the most? The most is that the people this is my friend Ellen. Ellen's in New Jersey. Her sister Jane has let me use this. And sometimes I get a little overwhelming when I give these talks, but really in the end, what matters the most? The most that matters is the person with intellectual disabilities, and our relationships matter, the connections we have. So remember this, and again, I can't help to stress, but be kind, please. Be kind to everybody. Thank you. Any questions?
Yes, thank you, Kathy. So we can take questions now. This is Kerry from the ARC. You can either chat them in or raise your hand and unmute yourself and be able to ask the question. So Jossie, why don't you, Jossie just raised his hand. Jossie, do you want to unmute yourself?
I did unmute myself. I had a question about using rubber gloves. A friend of mine gave me some rubber gloves, and I wore them once, and I was thinking of like washing my hands with the gloves on. I was wondering if I could reuse them. I've heard that actually it may not be a good idea, so I wasn't sure.
I think that, no, my phone, I can't, okay, so, around with rubber glove, I mean, you could, but the whole point is the barrier. The thing about it, you should be washing your hands before and after you use the rubber gloves anyway. So, I mean, if you think, the use
What about washing my hands with the gloves on? That's what I'm thinking. So
well, you could do that, but I sometimes, how do you get, the point about it, washing your hands with you could do it, but the reality is to make sure you're getting a good wash, you have to, I mean, if you've seen the videos you have to really scrub, you have to go down, and gloves, some of the gloves, I don't know, unless you have real tight gloves, getting these, and washing your thumbs, the proper washing of your hands to get a good clean. I don't know, honestly, if you could do that with a glove. But the thing about it, you could wash the gloves and let them dry. But the thing about it is that you're going to have to wash your hands anyway. Would take you off and on. I mean, you could use them again, but the surface of the gloves, I think I'd have to kind of look a little bit on that. I mean, I think you might be defeating, from some of my reading, you might be defeating the purpose of, I mean, with your hand, you can probably do a better job of washing your hands than washing the gloves and stuff. But I think if it makes you feel better, you can do that. But I think it's almost like you're still going to have to wash your hands no matter what. You can wash your gloves.
I understand that, but what I'm worried about is running out of gloves. In other words, how long can I preserve the glove? In other words, for instance, if let's say a friend of mine gave me, I think like about 30 pair of gloves. So for instance, if I were to go out today and wear a pair of gloves, could I wash those and maybe use those again, maybe one more time? So you
probably could. I mean, I think you could, but always remember again to wash your hands. Again, making sure, when you wash them, that you clean them off really, well. And I think that that's also a key point, is that cleaning any of these things off, making sure, that you, and also just to be aware, I mean, if you keep washing a lot, you're going to have little micro tears and things. So they may not be as safe as, it might give you a false sense of security, but do, try it and see if it works. But the other key thing is always to wash your hands anyway, no matter if you've got the gloves on or not. The key point is to wash your hands.
I see. All right.
Yeah.
Thank you.
Yeah.
Okay. How about anybody else? Anybody else have any questions for Kathy? Any surprises?
Yeah. Oh, did I answer everybody? Am I that boring?
Actually, I have another question.
Sure.
Sure, Johnson, go ahead.
In my town, I guess an organization offered low price coronavirus testing. I don't know if they're going to do it again, but I was wondering, I mean, I don't have any symptoms, and I'm wondering if I should take advantage of getting tested, or if I should leave that for people who, like, for instance, go out more than I do, for instance, and deal with more people.
Well,
I don't have any symptoms or anything,
okay.
But of course it doesn't.
Okay. Is it when the virus testing, is the nasopharyngeal swab, like sticking that big tube?
Yes,
like
yes.
picture? Okay. Okay. Well, that would show if you have the virus. I think part of the thing is that what would, I'm trying to, and I'm thinking out loud here, so bear with me, is that if you're pretty healthy, you don't have any symptomatology, what would that do for you? If you knew you have, I think if you knew you have the virus, then you would have to self-quarantine for 14 days. And because you wouldn't be, unless you started to have a show of symptoms and the symptoms were worsening, what would be the benefit of having a test? I think in some cases, the benefit, if you're staying home anyway, it really doesn't matter. I think my sense is that some of this testing is important for people who have work roles, that they come into more contact with people, that I think that is where having the testing would be more important, like our supermarket people who are the direct care staff, people who have to get out and have to do that and have essential jobs. To me, that would be the important thing, because having a test is like, when lots of times with any test, I'm like, what's the burden and benefit? What's the benefit of this? Let's think this out in the long run. How is this going to benefit me? For yourself, I think, knowing if you have it, you're and self-quarantine. But I also think that if you're pretty much staying inside and self-quarantining yourself to begin with, and following all of this infection control guidelines, period, using a mask, etc., because the whole point of masks for us now is protecting other people from us. So I think that it shouldn't, I would leave the test to, especially since we don't have as many tests as we like to think we had, leaving it for people who are essential in terms of, making sure we have groceries, making sure we have, the police or care providers, making sure they have access to these kinds of tests. Does that make sense?
It does, because another problem that occurred to me was that if I got the test and it showed that I was negative, that really wouldn't, I would still have to get another test at some point, because that would always be negative.
See, to remember these things is that these tests are one point in time. That's the other thing with it, is like, you're going to get the test. I mean, and I don't know, how long. I'd have to kind of look up and see, how long is a person positive for, before you start showing, and, the antibodies, at what point. I mean, years ago when I worked at the state institution at Belchertown, this reminds me with hepatitis B came into existence, and understanding the natural course on at what point do you get the virus, and it's a virus, and then as it starts to go, the virus loads go down, and in the meantime your body's building up the antibodies against it. So at what point and how long, I don't think we really know right now. I think that that's the issue. And again, any of these tests, it's a point in time. We don't know. And again, you know, and again, you know, some of these tests that you're going to get, you could get false negatives on the nasal pharyngeal swab. In fact, there's a whole, on the WHO, they have a whole listing on all the things that could go wrong while you have a false negative, and even if you have the symptoms.
Thank you. Very helpful.
Oh, okay. Good, good. Well, sometimes, you know, I think with a lot of these things is just to have a conversation with people. In fact, one of the things I think is important is the AARP had been having town halls. It's much like, I think, on CNN, you know, with the doctor and Anderson Cooper. It's nice to have somebody just to kind of talk out some of our specific concerns.
All right. Well, thank you, Kathy. That was so informative and a good review of what we need to do. Yeah. So I just wanted to let folks know that you'll all be receiving a copy of the slides today. So you'll have you know, be able to access the links to the resources that Kathy was talking about. So thank you all for attending today. We have our webinars 4 times a week. Thursday, Maura is going to be with a Mass state legislators and talking a little bit about what's going on. And then Friday with Ellen to give any kind of federal updates. And we're the ARC of Massachusetts, and so glad that you joined us. And everybody take care, stay well, and have a great day.
Thank you for inviting me. Thank you, everybody. Thank you for listening.
Okay.
Thank you.
Okay, bye-bye. Mm-hmm.